what's bone marrow transplant. We are here at SickKids Hospital in Toronto. It is my pleasure to speak with Dr. Krueger and to bring to you some information about what is it all about. Hi, Dr. Krueger.
Nice to see you again.
Hi, Leanne.
Hi,
Thank you.
Dr. Krueger.
Could you tell us about bone marrow transplant process and what the patients have to go through?
Absolutely. So bone marrow transplant is a very complicated procedure, as you know, in which we substitute the immune system of a patient with that of a healthy donor. And patients who require this kind of treatment are patients who don't have an immune system by themselves or who have very high-risk malignancies, leukemias, other tumors for which we require more aggressive treatment. The procedure itself is a very harsh procedure. It's one of the harshest treatment we actually have in our toolbox for patients with, for example, leukemias. And it requires quite a bit of care in hospital and out of hospital. So for example, for patients who come from other provinces, and we treat patients from all over the country here at SickKids. We are the biggest transplant center in Canada. We normally ask them to stay at least 3 months in Toronto. And then they will receive follow-up care at home. And we generally follow them for about a year. This is how long this treatment takes. And the way it looks is that we do admit the patients for at least 6 to 8 weeks. We deliver very high-dose chemotherapy or radiation, which is part of the treatment to make room for the new immune system. They're normally inpatients during this time. And then we see them in our outpatient setting. A lot of patients need to go back to the hospital. And then, as I said, it takes about a year for the immune system to fully recover and to have a normal immune system, a normal life again. Now, the process in the hospital is that's the most difficult part, and especially what we call the first 100 days. And I think that's where a little bit the fundraiser theme comes from as well. So the majority of complications that we see during the transplant process is really during the first 100 days, and that's because the immune system is the weakest in this time period. So we have a lot of patients who need ICU care during this time, a lot of treatment for infections, antibiotics, medications against viruses, etc. Now, infections being one of the main complications, we do try to prevent them by giving medications, but despite all the tools that we have, a lot of patients will still get infections, and we need to prevent them from infections. Some of the infections, in fact, the majority of infections actually come from bugs that the patients already have. But there are infections that you can bring from outside. So it's very essential for us to protect the patients from any kind of infection that can come from outside. And that's why we have isolation rooms on our unit. So we have two kinds of rooms, some rooms that are regular protected rooms, and then we have these extra isolated rooms. Those are high pressure rooms, and they just provide an extra layer of protection against any infection. And as you know, these rooms are very confined. Currently, they're very small. There's just room for a bed and a chair in there. There's no bathroom in there. There's not a lot of room for another bed for the caregiver to sleep at night. And then you can imagine that especially for older patients, teenagers, confined to a room like that without a bathroom, and they're all glass doors, going through a very harsh procedure like a stem cell transplant, not feeling well, having fevers, can't eat, etc., etc. It's really the roughest stretch that our patients have to go through. And I have to admit that when we first met, I did the same thing. I generally almost apologize for the rooms to prepare them that this is going to be a harsh time, but also the environment is not from what we want it to be, right? And we really want to change that, and with the efforts that you have been leading and the money that has been raised and is being raised really helps us to rebuild these rooms, to make them adequate, that parents can stay, that patients can go to the bathroom, don't have to go on the commode, and just have all the support that they need during this very difficult time.
I know how hard it is for families to go through this. Getting up in the morning, making sure that their kid is good, and all the results that are back every day, they take one day at a time during these 100 days. Emotionally, they're going through the roof, and I understand. So I guess with our help of our charity, BMT versus 100 days, we are helping a little bit for these rooms to get better, at least physically. They'll be in a better position to accept what they're going through, and hopefully they take their kid out of the hospital in a great health. So Leanne, tell me, like, you know, the money that we raise, the conditions of these rooms, can you tell us about it? Like, how do you use the money that we raise?
That's a good question. So just to give a tiny bit of context, these rooms were actually the first patients that walked through the door. It was in 1993. That was 30 years ago.
Right.
And so you have to imagine that these rooms are not only 30 years old, they're older than that, because that's when the initial planning and construction happened, probably in the 80s.
Right.
So currently what we're looking at with the funding is under our renovation, we're going to do a couple of things that are going to be huge for these patients. One, each of these rooms are going to have a bathroom. Patients will have their own tub, shower, and toilet to use with privacy. The parents are going to have their own sleeping area that's a little bit away from the patient's bedside. So currently, like Dr. Krueger mentioned, the rooms are very small. There's a room for a chair that the parent can sleep on, and that's it. But they will have a little bed off to the side.
Right.
The rooms are going to be larger. And I think one of the biggest things is that the entire unit is going to have a HEPA filter.
Right.
So currently, right now, what's happening is that patients are confined to the small area of their room. And when they're in isolation for 6 weeks, when they're expected to get up and walk afterwards, they actually can't, because their muscles shrink down a little bit, and they're not as strong as they were when they first arrived. So with having the entire unit with the HEPA filter system, they can actually get up, leave their room for short periods of time, do their physiotherapy, walk the halls, come back in, so they're not leaving as deconditioned as they are currently.
Right.
So all the money from this, which is amazing, thank you for doing this,
our pleasure,
is going to help towards providing very, very essential services.
I guess when it comes to donations, people always do for SickKids Hospital, no matter what. Wherever we go, we give it our heart. But it normally goes to the research of how to improve cancer or anything else, which is, we are all thankful because of that. The children come out of the hospital very healthy. But not that often we go through something that is for renovations, and for the parents that are going through that, unless you go through it, you really don't know what's going on.
Absolutely.
So I guess, like, hopefully our charity is helping towards that, to make people feel comfortable when they are going through that. It's unfortunate, but at least they have a better time at the hospital, going through that. I mean, the easiest and the simplest way you need to have is to have a shower.
Absolutely.
To have your own toilet in the room.
So critical to prevent the infections that Dr. Krueger was talking about.
Absolutely, absolutely. So I guess, I'm very happy that I'm a part of this together with my partners, that we are doing this Electric Real Estate and BMT versus 100 Days. And we are just really trying to raise as much money as we can. A lot of reputable developers are our partners behind us, and year is getting bigger and bigger. So I'm thankful to that.
And we're thankful for you, because it's going to make a huge difference for these patients that are confined to these rooms for such a long period of time.
It's not a small thing. You mentioned the word small. It's not a small thing at all. It's really a big thing. I can tell you, I sometimes have the pleasure or the privilege of meeting some of the patients again years after the transplant process. Or sometimes I go to other events where they talk about their experience with BMT. And in 9 out of 10 cases, they will talk about the rooms, and that this was the harshest thing in the whole process. So it's a huge factor in bringing these patients safely through the transplant process.
It's really heartwarming to hear that, and we do our best to raise as much as we can. I know SickKids Hospital is #1 in the country for bone marrow transplant. But these rooms, if they sort of improve a little bit, I'm sure it's going to be a lot better. Hopefully no one ever needs to go there, but in cases they are, at least we are helping a little bit for their well-being and staying a little bit more comfortable in the rooms. Anything else you would like to add to our conversation?
No, thank you so much for doing this. And as I said, it's a big impact. And they are actually, I don't know if you mentioned this already, they're hammering right now, right? They started with the process, so the money is already being utilized, right? And will so in the future as well.
Beautiful, so beautiful. I promise to bring you more and more, and we are here beside you, right by your side, to raise more money for you, always.